and go live. Let's listen in.
Travailleurs de la santé qui ont sacrifié leur temps des fêtes et qui continuent de sacrifier leur temps des fêtes pour soigner les Québécois dans des circonstances, on le sait, qui ne sont pas faciles. Je veux remercier aussi les Québécois qui, eux, ont sacrifié beaucoup de réunions de famille, pour éviter d'étendre la contagion communautaire.
This very strong contagion.
Vous avez pu constater
you have seen the incredible increase in cases in the past 2 weeks, and I would even say that we suspect that it's not the real number because there are many more cases that haven't been tested, but we don't know how many. But what we're trying to avoid, well, you won't be surprised, is overwhelming the healthcare system. As everywhere in the Western world, we're stuck in a vice where hospitalizations increase while more and more healthcare workers have to be absent. In other words, we have more and more sick people and fewer people to help them. As for hospitalizations, I want to underscore that there's a lot of uncertainty with this Omicron variant. We continue to talk with our experts on the subject, but we still need a few more days to give more precise projections. So to summarize, there's three great unknowns with the Omicron. First, there's no certainty on the severity of Omicron. It appears that the symptoms are less severe, but to what extent? Will this allow, for example, to reduce hospital stays? We don't know yet. Secondly, we see that in ICU, in former waves, we had, for example, one ICU case for every 4 hospitalizations. But over the past week, it's closer to 1 ICU case for 10 hospitalizations. Now, will this trend maintain or even increase? I would think it'd be very good news because ICU is very demanding in terms of personnel in our network. And the third unknown is the cause of hospitalization. And it's important to see that with the stats you see every day in the past 2 weeks. All those who come to the hospital are tested, and as the spread is very high in communities, we have a lot of positive cases. So now we have to separate the COVID-related hospitalizations from those for other reasons. We have to do it systematically to get an accurate portrait of the situation and to see what will come to us in the coming weeks. In fact, we hope to have answers to these 3 points and many others in the coming days, but we might have to act without waiting. And in fact, that's what we're going to do. To continue to limit hospitalizations, we are implementing immediately 2 new measures. First, we'll change the paradigm for healthcare workers. I'll explain that later. And secondly, we will add new groups for the 3rd dose. Now, my second point, what are the new measures that we're announcing for healthcare workers? I met with my colleagues, the unions, past days, and again this morning, with not only the unions from the healthcare system, but also professionals, like associations of physicians and so on. We put everybody together to put in these new measures. In fact, I would summarize that we have a social issue, and it's the same around the world. The Omicron spread is so exponential
énormément de personnel, comme j'ai expliqué.
We have to pull out a large number of professionals, as I mentioned, and that greatly affects capacities for Quebecers. We have to change the paradigm. What does this mean? It means that in the previous waves, we identified and withdrew as quickly as possible those employees that were at risk. But with the current vaccination levels, we're lucky. We're up to 98% of our healthcare staff that are vaccinated. We can do otherwise when there's a choice. And so, in concert with public health, with the ministry authorities, we made a decision that under certain conditions, positive tested staff will continue to work according to a list of priorities, but also risk management. And this is not only for healthcare workers. We're also working so that this measure can apply to all essential workers, not only in healthcare. If we want our society to continue to function safely, and the details for this will come in the coming days. So I'll summarize. If we had the staff we need, we wouldn't have to take this risk. But now, at this time, we have to take very concrete and very practical measures. It's a matter of risk and a matter of risk disadvantage balance. A few days ago, it was 4,000 healthcare workers that were absent. Yesterday it was around 6,000, and in coming days it'll be 10,000 absent healthcare workers because of COVID. So under the circumstances, we believe that it's best to send to work an employee that has been withdrawn under certain circumstances to maintain service. It's going to be case by case. It will be done in the context of each situation in each region. We see everywhere around the world. Healthcare systems have to deal with the same decisions. I remind you that we're making this decision because we'd rather do this rather than putting off all care, including critical care. So, if we have to do more postponement, we could have permanent damage for users. And the priority is always the same. It's to take care of Quebecers who need it. I'll try to give you some good news today. Third, the third dose vaccination. With the great week we had just before Christmas, there are just over 1 million third doses that have been given, and starting tomorrow, we will broaden again on the priority clientele groups to take appointments. Obviously, in the private health care and palliative care, and social welfare and home health, the community health networks, and public health inspectors, and personnel working in slaughterhouses for the food chain. They're essential. And I say that vaccination is already open for educators and a whole other series of workers. I ask you to inform yourself for the details. For the general public, and this is the good news, Daniel will give you details later, but afterward, it will be the general public and under 59 starting January 4. We'll open up appointments as we did in the past up to January 21st. And we will set up the schedules for those age groups. And I also want to remind you that sometimes people forget But 60 plus with chronic illness or health workers or those with double AstraZeneca vaccination, it's open. We will continue to accelerate the third dose because we want to vaccinate 2 to 3 million people, which would bring us to have vaccinated the entirety of the population. So I remind you, don't worry if you want to make an appointment, and it's a few weeks later. The idea for you is to get your intervention, and we will add scheduling as soon as we have capacity to do so. And once again, I'd like to address myself to the unvaccinated. You should know that it's the unvaccinated that end up in the ICU fighting for their lives right now. And even when they survive, there are long-term conditions, even for the rest of your lives. With the statistics over the past few days, and with Omicron arriving, it's very clear, very, very clear. Over the coming months, if the trend of the past few weeks maintains, the unvaccinated, either you get vaccinated or you'll get sick. And getting sick when you're unvaccinated is to put useless pressure on our healthcare system. It's never too late to get vaccinated. Go. You can also be part of the solution. So in conclusion, I would like that each one of us think of the healthcare workers at this time. Your nurses, our doctors, our attendants, our lab techs, our physiotherapists and pharmacists, and I've forgotten some. Respect for them. I implore you to take measures to stop the spread. I'm asking Quebecers, or I'm telling Quebecers the best way not to catch it and not to spread it, and avoid gatherings and reduce contacts. Each one has his own or her own responsibility, especially for those 60 and over who still haven't got their third dose. What's even more dangerous for them? I want to assure you that we will continue to follow the situation closely and will come back with additional measures if we need them as the information comes to the experts. And until then, I encourage everyone, and I thank you.